My name is Kouichi Tanemura. Thank you very much, Chairperson. There is a relationship between fatty liver incidence and follicular cysts, FC for short. Morrow found that 82% of dairy cows developed fatty liver within 4 months of pasteurization and presented symptoms similar to those of ketosis. In addition, a study of FC incidence by report found that 70% of the dairy cow studied developed cysts within 3 months of calving. This slide shows a comparison of ovulation in the normal estrous cycle and the mechanism underlying FC onset. In the former, hypothesis regarding FC onset. On the right side of the figure, the level of estradiol 17 beta, it's for short, in the blood increases. But when the level of hypothalamic estrogen receptors, ER for short, is low, no positive feedback occurs, and cysts develop because the luteinizing hormone surge, LH surge for short, cannot be induced. Silvia and colleagues found that the increased incidence of FC was higher in cases where serum progesterone, P4 for short, levels were slightly higher than normal. That is between 0.1 and 1.0 nanogram per milliliter. We hypothesized that the reason the concentration of P4 is slightly higher than normal in the presence of FC is that steroid hormone metabolic capacity is inhibited due to the development of fatty liver after calving. Based on the hypothesis, we tested whether treating FC with a liver activator would promote the treatment. Our first study evaluated the relationship between fatty liver and FC incidence. We compared the activity of the principal liver conjugating enzyme, UDP, glucuronosyl transferase, UGT for short, in the 70 cows. 62 cows had FC, and 8 cows had normal estrous cycle. Information of other method item is as follows. We measured UGT activity in the cows with FC and a normal cow, using it as a representative steroid hormone. As UGT conjugates radioactivity E2 and UGT into estradiol glucuronide. We used the amount product as the indicator of UGT activity. When we compared the UGT activity of the FC group and the normal group, we found that the FC group had a significantly lower level of activity. This suggested that steroid hormone metabolic capacity in the FC curve was inhibited. This slide shows a comparison of UGT activity between cows with FC, with and without a comorbid liver disorder, and cows with normal estrous cycle. The observation that UGT activity in cows with FC and liver disorder was significantly lower than in cows. Results suggested that having a comorbid liver disorder has significantly inhibited UGT activity. This slide shows the incidence rate for FC and for liver disorder by UGT activity group. For the low activity group, the blue bar shows a FC incidence rate of 51.6%, and the red bar shows a liver disorder incidence rate of 78%. This demonstrated that the incidence of FC and liver disorder were closely associated and that they negatively correlated with UGT activities. In our second study, we tested the use of the liver activator to mercapt propionyl glycine, also known as geopronin, and MPG for short, to treat FC. Based on the finding to Tanemura and colleagues that MPG was highly effective in curing fatty liver in 82% of their case. For our study, we used 53 cows diagnosed with FC to test the drug MPG and human chorionic gonadotropin, HCG for short. This slide shows the 4 FC treatment groups used to test different MPG and HCG treatment protocol. Each blue triangle indicates an MPG treatment, and each red triangle indicates an HCG treatment. The MPG-only group was given only MPG, and both HCG and MPG group was given both drugs simultaneously. The MPG-only, after HCG treatment group, was first given HCG, and cows that showed no effect 4 weeks later wasn't given MPG, and re-diagnosed 4 weeks later. The both HCG and MPG after HCG group similarly was first given HCG, and cows showed no effect 4 weeks later, wasn't treated simultaneously with HCG and MPG, and re-diagnosed 4 weeks later. This slide shows a comparison of luteinization and conception rate among treatment groups. After cows were inseminated up to 3 times. In the chart, the luteinization rates are shown in blue, and the conception rates in red. Treatment response rates were significantly higher for the MPG-only group, which had luteinization rate of 86.7% and conception rate of 69.2%. And for the MPG only after HCG group, which had luteinization rate of 56.3% and conception rate of 66.7%. This slide shows the timing of luteinization in cows, for which treatment was successful. For the 2 treatment groups treated only with MPG, luteinization occurred in a total of 22 cows, and for the 2 groups treated with both MPG and HCG, it occurred in a total of 14 cows. Most comparator found during the first to second week. After treatment, by the second week, there was no difference in luteinization rate. In conclusion, our findings suggest that in cows with liver disorder, UGT metabolism of E2 and P4 appeared to be inhibited, resulting in increased level of E2 and P4 in the blood. This higher level may lead to a decrease in ER, which causes onset of FC. Furthermore, our finding also development that FC can be successfully treated by administering a liver activator. Thank you for your attention.